Welcome everyone to this special webinar event in collaboration with Mend and Fullscript. I'm Amy Regan from Fullscript, and I am so glad that you joined us today. A few housekeeping notes. Please place all questions you have in the Q&A box for a chance for them to be answered at the end of the presentation. This webinar is being recorded, and the recording will be sent via email to all attendees and registrants, and there is a copy of the presentation slides in the handout section for you to download and follow on. Today, we are joined by Dr. Kim Biedermann, Chief Science Officer at Mend, Dr. Dan Edwall, Scientific and Medical Advisor at Metapallet AS, and Dr. Jeff Glad, the Chief Medical Officer here at Fullscript. And I'm so glad to welcome you all.
Thank you.
Thank you very much.
Thanks, Amy. That was awesome. Yeah, no, incredibly exciting. So you've done the introductions for us, and so we'll jump right in, and I'll start by letting everyone know what the overview of today's webinar will look like. So first, I'll do sort of a brief overview. Most of it should be review for all of us here in the webinar on cardiovascular disease, but really dig a little deeper into endothelial dysfunction being a real focus of both prevention and what we should be thinking about in terms of working with patients in improving cardiovascular outcomes. We'll then pass it to Dr. Biedermann and Dr. Edwall to discuss anthocyanins as a novel approach to supporting cardiovascular health, sort of teed up on the endothelial dysfunction side of things. We'll then introduce Mend, which is a really exciting partner for us at Fullscript, and Healthberry as an ingredient that has some very interesting science behind it that we'll talk about today. And that's really why we're so excited here at Fullscript to talk about this, because of the clinical validation of what we're bringing to the platform to help you and your patients as you talk about potential, supporting potential outcomes around cardiovascular disease. Talk a little bit about how, Fullscript and Healthberry have sort of come together, introduce a protocol that we've built unique to this webinar that we'll be sharing afterward, and I'll walk through the science behind why we're making these recommendations. We actually will not be doing a demo, but we certainly have an entire team happy to do a demo for you if you desire. So feel free to ping us or raise your hand in the Q&A, and Amy will make sure and get you connected to somebody on our team. We'll do a bit of a summary, and then as mentioned, we'll kind of go through the Q&A. So let's touch on cardiovascular disease and endothelial dysfunction. I mean, obviously, this is a leading cause of death in the United States, and quite frankly, worldwide. You have almost 700,000 Americans who've died from cardiovascular disease in 2021. If you look at the average age of developing cardiovascular disease in the 50 to 80 years of age population, it's more than half of males and almost half of all females have a risk of developing cardiovascular disease. In the US alone, 76.4 million adults have hypertension, 16.3 with coronary artery disease, 7 million have had a stroke, and 5.7 have heart failure. This is obviously a big concern, and we're all looking for tools to potentially, work with pharmaceutical medication, or if there's been intolerances or side effects, or patients just don't have interest in the pharmaceuticals that are available, then we need tools to help us work with our patients and guide them with the evidence that's available. And so let's talk about endothelial dysfunction specifically. So there's a known two-way connection between cardiovascular disease and endothelial dysfunction. That dysfunction is characterized by the decreased production of vasodilators, nitric oxide being an example of one of those, and increased endothelium-derived contracting factors, both of which sort of work against us in terms of optimizing cardiovascular health. Risk factors include the classic ones we all know: elevated blood pressure, diabetes, elevated lipids, as well as non-classical factors, chronic stress, environmental stress, that have become more known and are certainly part of the discussion that we're having with patients on a daily basis. But all of these in collaboration, contribute to the development of the endothelial dysfunction via oxidative stress and vascular inflammation, which further contributes to that cardiovascular disease. If we look at the list of common supplements that are being used today, we look at our platform, we look at the evidence available, we see that most of them are not focused on this underlying endothelial dysfunction, oxidative stress, or inflammation. Now, I said most because obviously the exception in this list here is the omega-3 fatty acids supporting inflammation, but generally we don't consider that to have a role in antioxidation. So, certainly these dietary supplements, the ingredients here still of great value, shouldn't be avoided in the context of trying to support patients with cardiovascular disease. But let's talk about how we can broaden the coverage and broaden the focus areas and really sort of double click on the endothelial dysfunction part of this. So I want to introduce the concept or actually just anthocyanins in general and how they may play a role in cardiovascular health. Dr. Biedermann, you want to take it over from here? You're on mute. You're on mute, maybe?
Yes. Thanks, Jeff. Appreciate it. So anthocyanins are a group of antioxidants that are found in many foods and are actually what gives fruits and vegetables their red, blue, and purple color. These are water-soluble pigments, and they belong to the flavonoid family, which are polyphenols known for their radical scavenging, antioxidant, chelating activities. I want to emphasize here that not all fruits have the same type and amount of anthocyanins. For instance, black grapes and strawberries have low anthocyanin content generally, while bilberries and black currants contain significantly higher amounts. So anthocyanins have become an emerging field of interest in recent decades. A growing body of research indicates they may play a vital role in health. Animal and human studies show that various anthocyanins have preventative or therapeutic benefits, and this includes the following areas of cardiovascular, brain, liver, diabetes, and eye health. And anthocyanins may also improve endurance during exercise. However, despite these data, most people in countries around the world have an average intake of dietary anthocyanins that are well below the recommended average of 80 milligrams per day. And unfortunately, US has one of the lowest average intakes of only 11 milligrams per day, which is only about 15% of the recommended amount needed to see these benefits. Now, the strongest benefits that's emerging is for cardiovascular health. Anthocyanins have a unique ability to impact several key risk factors that drive progression of cardiovascular disease. So these include activating platelets, reducing oxidative stress and inflammation, improving insulin sensitivity and glucose metabolism, optimizing lipid profiles, and especially cholesterol and triglycerides. Importantly, anthocyanins may also improve endothelial function, as Jeff was alluding to, by increasing nitric oxide and vasodilation. Now, Dr. Dan Edwall will now review the clinical data supporting the role of a standardized anthocyanin extract on these targets.
Thank you, Kim. I'm joining you from Sweden this evening. Well, it's dark over here, but for clarity, I'm just using my audio feed to speak to you tonight. So let me go through some of the clinical studies that have been used to describe these beneficial effects of anthocyanins. The first study we'll be looking at is what both Jeff and Kim talked about earlier, endothelial function. This study, published in 2011, included 150 participants, middle-aged, but they all had a raised lipid profile. And the investigation was carried out with a 320 milligram dose of anthocyanin. And what we can see in the graph on the right-hand side of the slide is flow-mediated vascular dilation after certain time points after ingestion. Even though there were 150 participants. The specific diagram shows the N equals 12 participants for that particular part of the study. But I think it's important to show vascular dilation as an important factor. The study also investigated or searched for clues on mechanism of action, and they used phosphodiesterase inhibitors, in other words, inhibitors of nitric oxide. And they could show that the induction of such inhibitors abolished the effects of the anthocyanins. But it was, of course, important to show that the increase in flow-mediated vascular dilation was clearly shown. There was also benefits in terms of the lipid profile, a reduction in LDL cholesterol, increase in HDL cholesterol, and other parameters. I'm going to move on to another slide with even more studies. And what you can see here in the second column is that these studies all include patients with a perturbed or dyslipidemic profile. In the Quinn study, the first study on the top bar there, they give a description also and the composition of the Healthsbury product, which contains 17 different anthocyanins dominated by variants of cyanidin and delphinidin. But these 17 different anthocyanins are derived from naturally grown bilberries and black currants. And that's the common denominator for all the studies in this slide, except for the Zhu 2012 study over here. I hope you can see my little marker here, where they tested two specific single anthocyanins. But the common denominator again, except for the dyslipidemic patients, is that the dose was 320 milligrams per day. The outcome of all these studies showed a decrease in LDL cholesterol and an increase in HDL cholesterol. So taken together, we have some strong evidence looking at these double-blinded, placebo-controlled, randomized human studies. I'm moving on to another area of interest. In addition to the benefits with regard to dyslipidemia, we're here looking at anti-inflammatory capabilities. And in the first study here by Carlson from 2007, they also gave a very detailed description of the Healthsbury components, but also made investigations into how much anthocyanins could be found in a regular serving of bilberries, for example. So the 300 milligram per day anthocyanins was equal to roughly 100 grams of fresh bilberries. And I bring this up because I think it's an important point to make that this Healthsbury product is by no means an extreme extraction process. Again, this is a water-based anthocyanin composition, and it could be very well within what could be a part of a normal diet, 100 grams of fresh berries. But looking on to the other, both Lee and the Zhu studies were present in the previous slides, but here we address anti-inflammatory capabilities and a lot of markers used, key markers for limiting inflammation parameters are here also. Moving on, next slide shows an interesting observation for obese patients and patients with a sedentary lifestyle. This is actually 2 different studies from the same research group. And the slide here shows the effects in the placebo-controlled crossover trial in sedentary patients. The other data shown here is for another randomized double-blind placebo-controlled study with patients with a BMI above 25. So again, sedentary lifestyle, obesity, etc. I think that brings back memories of what Jeff was showing earlier on, that these are clearly risk factors with a shortened expected lifespan taken together, and also the impact of anthocyanins on limiting these risks. Then we move on to another risk factor, which is the diabetes, the type 2 diabetes. Here, again, the Lee study, we've seen it before in my previous slide, but here they specifically addressed type 2 diabetes and type 2 diabetic patients. Again, a randomized placebo-controlled double-blind trial. In this 58 patients, there were 29 individuals in each group receiving either the Healthberry product or a placebo control. And you can see here the authors summarized their effect, protective mechanism by anthocyanin on diabetes, closely correlated with prevention of dyslipidemia, which we saw on the earlier slides, lower systemic oxidative damage, and increase in insulin sensitivity. So the slides I've been showing so far all address subjects with an unhealthy profile, so one way or another. Inflammatory markers are high, cholesterol levels are high, BMI is high, etc. And we like to point out that for treatment of diagnosed diseases, we turn to pharmaceuticals. But I think it's of interest to point out that using anthocyanins as an adjunct product or adjunct therapy can also influence outcomes for such patients. So I'd like to finish off by showing a slide on perfectly healthy adults. This is from a 2019 publication where a randomized placebo-controlled double-blind crossover study is shown here, where they utilized either a blank control or the lipid and mineral contents of fresh bilberries, or the anthocyanins in the Healthberry, or fresh bilberries with a similar amount of anthocyanins present. And also, again, we're looking at flow-mediated vascular dilation and clear significant effects after 2 and 6 hours after ingestion. I think that's a good sign that we can show such effects on vascular dilation also in subjects that have a perfectly healthy endothelium. The next diagram here shows also that we can trace an ED50 value from both blueberries and the anthocyanin product, which is a nice effect if you're interested in science, that you can also trace these effects in dose response studies. Again, placebo-controlled, double-blind, crossover human study. I think I have some comments also on the other slides coming on later, but I'd like to hand back to Jeff at this point.
Yeah, thanks so much. I mean, you can all see why, back in February, when I'm meeting with the Mend team and getting to know them and understanding the depth and the breadth of the research behind Healthberry is so exciting for me as a practitioner and for my patients. And it's why, Fullscript is really excited to be partnering with Mend and discussing the Healthberry ingredients. So now I want to give some more background on that. So Kim, if you want to help us, take it from here on talking about Mend and Healthberry as the ingredient that we just talked about in this research.
Sure. Thanks, Jeff. And yeah, the data, to us was very, very impressive as well. And so this is really in our wheelhouse. Mend is a leading innovator in evidence-based nutraceuticals and is focused on preventative healthcare and really creating new category that incorporates the scientific rigor, as you've seen, behind these and pharma products, and applies that to botanicals and dietary supplements. So you can see the founders of Mend on the right, Isaiah Syed, who's the CEO, Helene, Whitney, and Justin. And all of them are very, very passionate about the transformative power of food as medicine and in creating nutri-pharma products, as we call them, customized for each stage of the healing journey. And on the next slide, what sets Mend apart from others is in their scientific evidence-based approach and quality-first mindset. First, Mend applies rigorous scientific principles to the field of nutrition by identifying the most bioavailable, highest quality research ingredients with proven effectiveness and safety. We focus on really understanding the relevant health and wellness needs and then finding those targeted solutions. And third, products are manufactured in the US under GMP standards. And as well, each product is independently tested to ensure purity and potency throughout its shelf life. Finally, Mend collaborates very closely with leading healthcare practitioners and researchers to conduct additional clinical studies, as well as to actively seek input on how to improve and optimize Mend's products, as well as their protocols. And here's a little more detail about the manufacturing process. This Healthberry I'm sorry, I'm on the wrong slide. And this is why Mend is now offering Healthberry, which is a standardized anthocyanin extract. As Dan mentioned, Healthberry has been independently studied in more than 20 published randomized controlled trials. And I didn't ask you this, Dan, but I was counting it was around 1,000 patients plus. We can discuss that in the Q&As. The original product, Medox, has been marketed in Europe and China, for over 20 years now. And as you heard from the clinical data, Healthberry impacts multiple targets in key cardiovascular risk factors, including inflammation, endothelial function, oxidative stress, and glucose metabolism, as well as improving lipid profiles. The product is standardized for a minimum of 160 milligrams per day of anthocyanin. And regarding safety, this compound is classified as GRAS, generally recognized as safe, with no known reported adverse events or contraindications in the 20 plus years it's been in the market or in the clinical studies. Here's a little more detail about the manufacturing process. This extract is produced from bilberries and black currants by a process that retains the full antioxidant potential while overcoming seasonal fluctuations in the raw materials. So like many other marketed anthocyanin products, this potency in Healthberry is standardized and a stable blend is guaranteed. The wild bilberries are actually hand-picked in Scandinavia and are processed along with the black currants to extract known amounts of 17 different anthocyanins. Dan can give you a rundown on what they all are. And this combination provides a unique synergistic antioxidant potency.
If I may, just briefly, Kim, in my experience, the actual Healthberry product is not as pink as in this slide. It may be something with the presentation graphics to do, but in my experience it's a very, very dark blue powder, almost black. But I'd also like to add on to what you said in the previous slide regarding generally regarded as safe, the grass. In Europe, where I'm active, the European Food Safety Authority, EFSA, also has anthocyanins labeled as an additive that can be used as a coloring agent because of the very, very strong blue and red color. So it's definitely allowed and sometimes used for that particular purpose. Again, what we're looking at here are the medicinal effects and the health effects and the shown effects on several important factors for maintaining health. That was just my brief comment. Thank you.
Yeah, very good points. And yes, it does look really pink. The Healthberry product that I have is a real dark purple. So I don't know. The slide is somewhat strange in that regard. All right, so here's our protocol that we recommend. Healthberry can be incorporated into early prevention strategies as an adjunct to both exercise and dietary changes. So we recommend 1 capsule or 160 milligrams per day for those who with a normal lipid profile and who could benefit from proactive use to support healthy inflammation or reduce oxidative stress. And we also suggest using 2 capsules or 320 milligrams per day. And you saw from the clinical studies above, that was the typical amount that was used in the clinical protocols. And give those for those patients who may be at risk after consultation with their doctor. Jeff, back to you.
Yeah, thanks. So, not only is the research incredibly compelling, but the fact that this has been used for 20 years and has the safety profile, this isn't the first time we're going to be using this and seeing patients taking this product, makes it even more, comforting as a practitioner to know that the safety, of 20 years of use is there, along with the evidence supporting recommending it. So let's talk about actually recommending the Healthberry product using Fullscript. And so what we've built, and keep an eye out because in the post-webinar emails you'll receive our protocol for this. And if you're not familiar with Fullscript protocols, our medical advisory team is constantly building evidence-based protocols to make sure that your clinical care has evidence behind it. And what you'll see in our protocols, it is that evidence justification. You'll also see popular chosen products to match the ingredients from the research, but you as the practitioner have complete independence to design your own version of this. If you prefer different products for, say, some of these other ingredients, feel free to switch those out, title the protocol as you see fit. We're just merely giving you the foundation here. So you'll see the anthocyanins, searching Healthberry on Fullscript will find that product. And I should step back here and say, we have a rule at Fullscript. Every department uses their own acronyms. So let's walk through the acronyms first so you know what we're talking about in terms of the evidence supporting these things. In the antioxidant department, TRAP is total radical trapping antioxidant parameter. FRAP is ferric ion reducing antioxidant power. MDA is malon dialdehyde, which is a known marker of oxidative stress. TAC is total antioxidant capacity. I think the only one I knew here was GSH as reduced glutathione, but this is how this evidence is being measured and proven. On the endothelial support side, the VCAM is soluble vascular cell adhesion molecule 1, FMD, which was mentioned in some of Dan's studies he walked through, flow-mediated dilation. FBF is forearm blood flow. PWA is pulse wave analysis, NO is nitric oxide. Big focus for us in terms of endothelial health and endothelial function. On the inflammation support, we should all be familiar with those markers and what they represent. Many of us are measuring them in our patients. And so the protocol itself, again, the anthocyanin product, there's CoQ10 with a dose of somewhere between 100 and 200 milligrams per day. Folic acid, typically, we're using methylfolate, most of us, omega-3 fatty acids, which I mentioned early on as one of the really hallmarks of focusing on inflammation, and vitamin C rounding out that protocol. So we're doing this webinar and presenting this evidence, but it's because Mend and Fullscript have partnered together to arm practitioners with evidence-based support for cardiovascular well-being. And Healthberry is now exclusively available on both the Emerson and the Fullscript platform to our practitioners, which we think is a really important move for us in also making sure that we're directly partnering with all of the suppliers we work with on the catalog. This is exclusive to the catalog so that it's exclusive to your care, and connecting your patients to the proper treatment plans. So you'll be able to see it in the catalog today, again, both in the wholesale side, in the Emerson side, within the Fullscript world. So let's summarize and then get to Q&A, because I know there are some questions out there and we've got these great experts to kind of handle them for us. But ultimately, Kim, I think this is yours to kind of cover the summary, and Dan teaming up with you.
Yes. So thanks, Jeff. So thanks all for taking the time to attend this webinar. Hopefully you learn a lot more about anthocyanins and how they are associated with many different health benefits, with the strongest data being around cardiovascular health and the biochemical targets. Anthocyanins sourced especially from bilberries and black currants that are found in Healthberry create a potent, rich, yet broad spectrum of anthocyanins. They complement each other. We didn't really talk about this, but they actually synergize for their antioxidant effect. The potency of Healthberry, hopefully we've explained, is pretty clear. Dan, would you want to take us through the summary here?
Yes, certainly. Thank you. In this brief webinar, we have very quickly touched upon a number of published clinical trials, and of course the focus has been cardiovascular health, but there are other reports out there, and I'd like to emphasize that throughout the 20 years that this product has been on the market in Europe, the policies of Mend Fullscript, the founding company, has been not to commission clinical studies from academic group, but instead make available the product and supply product and placebos, and then let the academics do whatever they want, rather than being dictated from the company of what they should be investigating, etc. I think it's a good sign that these studies have not been commissioned specifically to show, but instead based on the expertise and experience of academic groups all around the world that have shown several health effects. But again, today we talked about cardiovascular health. We looked at endothelial function with the flow-mediated vascular dilation. I'd like to comment also what Jeff alluded to in terms of the abbreviations with the pulse wave progression, which is a parameter used to assess vascular stiffness versus vascular elasticity. So the pulse wave velocity is another parameter that is prevalent among the study, again speaking to or showing cardiovascular benefits of this anthocyanin combination. The hyperactivity of platelets and the clot forming capacity while maintaining normal blood clot forming capacity is an important study finding that we illustrated by patients either with high BMI or with sedentary lifestyle. Inflammatory markers and oxidative stress was also touched upon, as well as the antioxidant capacity. For the last bullet point, I already pointed out that there are a number of studies out there. In fact, I know that there are more than 30, I think there's 32 now published studies, whereof 23 are product-specific, well-controlled human studies. So I in my role, I have a clear conscience and a very appreciative background for the health effects that can be shown and have been shown in published scientific articles in journals.
Incredible. Yeah, thank you so much. So folks, scan either of the QR codes and find more information, find the products, both in the Emerson and the Fullscript catalogs. But I want to jump right in. And again, you're going to get, access to this webinar. We're going to follow up via email to all the attendees with the protocol that I mentioned a couple slides ago. But we are getting some questions in. So we'll jump to the final slide here, and I'll sort of facilitate the Q&A, Amy, if you'd like. But I've got a couple off the top of my head here and on our roster. If you see more, I'll have you jump in. So the question first comes from me. I'll be a little selfish here, Kim and Ed or Dan. As I've been suggesting and recommending this product to my patients, I'll say the word anthocyanin, and you'll see the sort of confused, why are you speaking fancy medical talk to me? Like, let's just talk about, what this is. And I sort of say, well, it's an antioxidant. Most patients understand that word antioxidant. But I think you both, sort of walked through the deck here and explained the word antioxidant to describe the role of anthocyanins in the body. It is really underselling what value it has. So, any practical guidance and education on, how we talk to patients about what this is. Obviously the research is super compelling to the practitioner, somewhat compelling to patients, but any guidance on, sort of describing the potential, for what anthocyanins are doing in the body?
Yeah, I can start. And what I'm so impressed with this is that it's, impacting many targets beyond what an antioxidant can do. And I'm especially impressed with its role in endothelial function. And I think it's more of an anti-inflammatory property. And this actually will answer one of the questions that I see in the Q&A. But the anthocyanins is particularly good at inducing nitric oxide in endothelial cells, resulting in a localized vasodilation that you can actually measure after its first ingestion about 2 hours later. And that's just, to me, that's amazing. So I think, that's how I would answer it, Jeff, is that it really plays a critical role in a whole variety of areas, and especially in endothelial function and health.
Okay, if I may jump in, then I would take sort of the helicopter view of oxidation, antioxidants, and so on in our metabolism. And metabolism in living organisms in general generates or can generate reactive oxygen species. It's a natural phenomenon, and our bodies as mammals, as well as other life forms, have to deal with this reactive oxygen species, because they can be very, very toxic and kill cells, etc. So we have a natural ability to counteract oxidative stress. But our lifestyle today, usually in terms of not so very healthy diet and stressful lifestyle, etc., can increase the oxidative stress load. And I think the why would plants and berries and strawberries and bilberries need antioxidants? Well, they get their energy from solar radiation, and their metabolism also generates reactive oxygen species that have to be handled, and therefore they also need antioxidants. So from that helicopter perspective on oxidation and oxidative stress, I think it's very nice that even though we have natural antioxidative capacities in our bodies, we can further influence or generate protection by adding antioxidants like these anthocyanins.
Well, you guys both get gold stars for being the best co-hosts of webinar as you answer multiple questions with one answer. That's incredible work. So next question is more about on the side of both. The next two questions are both toward, trying to consume this level of anthocyanins from food, right? And trying to minimize maybe the supplement list that a patient needs. Talk about cooking, food processing, preparation methods, and how those may or may not impact the levels of anthocyanins and their bioavailability. Is there much data there that we can speak to?
If I may get started, I think the slide that was early on in the slide deck showing natural levels of anthocyanin ingestions, where the US average population numbers showed a very, very low ingestion level, whereas the Finnish population had a significantly higher. I think that relates to the types of diets. If your diet is dominated by sort of industrial food, ready-made food that has been processed and kept for a long, long time, in comparison to fresh vegetables, fresh berries, perhaps even a glass of red wine, which contains a lot of antioxidants in the anthocyanin department. So trying to answer your question, Jeff, I think fresh vegetables, leafy greens, very pigmented, dark colors, etc. We've seen studies from brown rice and black rice and black grapes, etc., etc. Those are all high in anthocyanins. And we also know that the food processing, long-term cooking, keeping your stew on the stove for a long, long time, degrades these compounds, and that is also reflected in the sophisticated production methodology that has been developed in order to preserve the anthocyanins and being able to put them in a capsule in the Healthberry product.
Yeah, if I can add, anthocyanins as a chemical class are very susceptible to both degradation by both heat and oxygen. And frankly, they're very susceptible to it. So fruit storage, plays a critical role in likely reducing the available anthocyanin content, of fruit. I think there was a question on what volume is needed for 320 milligrams of anthocyanin. So as we've said before, about 100 grams of bilberries are needed, are essentially produced around 300 to 700, and that has to be very fresh. What is 100 grams? About 3.5 ounces. So it's about 3.5, 4 ounces are needed. But again, the levels of storage, how long they've been harvested, what conditions they were at will severely impact the level of anthocyanins. And anthocyanins have cyclic variations, from season to season as well. So yes, you can get it from fresh fruits, but it'll be extremely variable.
And if I may add on to that, fresh berries are not always available too. And that's another factor if we compare to the level seen in the Finnish population, for example, where fresh berries are part of a normal diet, but they're not available all year around. So then a daily capsule or two of the Healthberry product allows you to have these anthocyanins available, even if you're not out there picking fresh berries. I see another question that relates to the 320 milligram versus 160 milligram dose evaluation. And I didn't bring out that study, but there are studies with dose response investigations that show that already at an 80 milligram dose, in other words, half a capsule, you can detect beneficial effects. But the more robust effects that were shown in some of the studies I described in my slides require the 320 or around 300 milligrams of anthocyanins. So again, there are dose response studies, and there are studies comparing to the amount of fresh berries that you need in order to see these effects. I think that would answer the question.
Yeah, that was great. And sort of a follow-up question that also has come in, asking about a patient at higher risk. Would there ever be consideration for 4 capsules a day? And then they asked, what labs would you follow to determine when and if you may move to that lower dosing regimen of 2 capsules a day or 1 capsule a day? Any recommendation? First of all, any science there on, say, 640 milligrams, and then discussion on what you might follow to kind of judge the success.
If I may again jump in, I would say this gets us. I know we're talking to healthcare professionals, but it's always important to underline that such high-risk patients should probably not rely on nutraceuticals alone. So I think it's an important step to have a very clear correspondence and exchange of ideas, and know that he or she is actually seeing a physician, getting tests, etc. As the B part of the question would be, how do you know that you're getting anthocyanins? And I know that it's extremely difficult to measure anthocyanin contents in the bloodstream, for example. Some studies have tried, and they have shown quite clearly that it's actually metabolites of anthocyanins that have or that create the effects that we're seeing. So tracing anthocyanin contents or levels in the bloodstream is extremely difficult, but there have been studies published showing, or quite convincingly showing, that it's a part of the gut flora that present metabolites that are active and that actually make the effects that we can detect in terms of inflammatory responses, vascular responses, etc.
That's an area of growing research that is quite fascinating. And similar anthocyanins have been researched and have been found to act as prebiotics to help induce butyrate. And that is thought to be one of the mechanisms by which it can control glucose metabolism and insulin sensitivity. Very, very fascinating research. I look forward to more data on that. Regarding the dose, I think I'm seeing the product's very expensive. And Dan, please expand on this, but the data that we've seen, the data that's been generated, generally we're seeing maximal or near maximal effects at around 360 milligrams. I don't recall any higher amounts that produce more significant impact. Have you, Dan?
No, and one of the slides I showed where a dose response study was conducted in healthy adults also showed that there is a plateau where a maximum effect is present, and you cannot influence it further by higher dosing.
Correct. And from what I understood from all the data, the minimum effective dose was around 80, but did
Correct.
not impact all of the risk factors, especially, I believe, cholesterol and lipid levels. So that's why we came up with the 160 as this in the capsule, and then the higher amount, 320, as the maximum amount.
Yeah, I think there's a couple questions here that kind of point to, maybe I'll sort of create a question based on these, which is, how much of this evidence is specific to the healthberry ingredient, and how much is just generally assigned to anthocyanins, where a focus on consuming enough from the diet, which we talked about is possible, but can be difficult. Maybe sourcing other bilberry powders, blackcurrant powders. Obviously, there's some quality issues that may be involved there, depending on the source. But can you speak to the specificity of the healthberry as the ingredient?
I know that if you go to PubMed and look for anthocyanins, you will find more than 3,000 publications on anthocyanins. So there's a lot of research out there, and clearly there are other sources available. Coming back then to the healthberry product specifically is the fact that it's very well validated in terms of quality assurance, and that you get the right amount in each capsule, which may be difficult if you're turning to, I saw here, the red cabbage and purple onion, etc., etc. I'm certain that the anthocyanin contents of other healthy foods with strong color is perfectly healthy, but it's more difficult to assess the kind of dose you're getting from such sources. I think the standardized nature of this healthberry product is the most important factor.
Yeah, and that's what impressed us as well. It was the standardized process. It was the quality controls. It was ensuring the content throughout its shelf life, as well as the clinical data around the healthberry itself. There was no other anthocyanins that we saw that had a more complete history and profile.
That's great. Someone asked if the sources of the berries are organic.
I do know for a fact that the bilberries are picked fresh in the wild woods of northern Sweden, Finland, and Norway. So the correct answer to that would be that it's a very natural environment, but it's not certified organic, because then you would have to have very controlled conditions for the growth. So I would say it's natural, but not certified organic. And that would also be for the farmed blackcurrants that are used from New Zealand.
Incredible. Amy, you want to wrap for us? That was very, very great information. Appreciate the expertise and the knowledge from both Dr. Edwall and Dr. Biedermann. It was a pleasure being with you. Amy, I'll hand it off to you to wrap up.
Excellent. Thank you so much to everyone who attended today, and also thank you to our guests for this great presentation. Look for an email with a link to view this recording we'll be sending on Friday. Anyone who has any additional questions after they get out of the webinar, you can send them right over to me at my email address, amy.regan, that's my full name, amy.regan @fullscript.com. I hope everyone enjoyed the presentation, and just sort of final thoughts. Do you guys want to wrap us up a little bit and think about what we learned today? little extra at the end here. So
yeah, I'm happy to start and give them a couple seconds to but I already voiced my excitement for this. I mean, the medical advisory team and myself can continue to, evaluate the potential future, partners that we bring into the catalog. And really one of our biggest requirements is, where's the evidence, right? So much of our industry and the type of care we deliver, we feel incredibly strong about, given the evidence that's available today and what we're doing. And we want to grow, the recommendations of high quality supplements and evidence-based recommendations. And it's partners like Mend that help us take those steps. And so it's really exciting to be here. It's really exciting to present this. And any quick parting thoughts, Kim or Dan?
No, I want to thank you very much for the invite to just showcase the clinical data, in both what's been done and also future opportunities as well. We're very, very proud to be able to introduce Healthberry to patients. We feel that it is an extremely fantastic adjunct, as I mentioned before, to a healthy diet and exercise program. Thank you again.
Well, I agree, and in retrospect, I apologize for my heavy Swedish accent. I hope I've been clear enough to convey this message. I would like to bring back the perspective of some of the questions that came from regarding other sources, etc. And I would say that modern lifestyle incorporates the feeling that, well, if you're sick, you take a pill and boom, you're cured. This is a different flavor kind of thing. I would argue that the things that you do every day, those are the ones that are important. Your diet is part of the things you do every day. You go to work, you sleep, you meet friends, etc. Your diet is extremely important. And the fresh diet with anthocyanins and polyphenols present is extremely important. I think this product, with its standardized background, etc., helps you provide to your body something that you need every day, and the studies show very nice long-term results.
Excellent. Thanks everybody for joining. Thanks to Dr. Biedermann, Dr. Edwall. Appreciate your time, and take care.
Thank you.
Thank you.